Your family doctor recommended that you see an eye doctor for the examination of diabetic retinopathy. This is a disease of the back of the eye that's found in diabetics. Diabetic retinopathy is one of the leading causes of blindness now, and we'd like to prevent you from ever having diabetic retinopathy by diagnosing it at its earliest stage, if it occurs, and if we find the retinopathy, we can now treat it with laser treatments performed by our retina specialists. In brief, diabetes is really not a disease of sugar. While rarely high levels of sugar can cause a problem in the bloodstream, the most common feature of diabetes is a disease of blood vessels, what we call vasculopathies. The blood vessel disease can be large blood vessels like your heart, or small vessels that are found in your kidneys or attached to the nerves in the body. And it's the blood vessel disease in diabetes that is the common denominator for most symptoms of diabetes. The very small blood vessels within the eye, in the retina, can, under certain circumstances, be involved in diabetes, and this is what is called diabetic retinopathy. What the ophthalmologist sees is the equivalent of a leaky pipe, a leaky blood vessel within the eye where small drops of blood or protein can leak from the blood vessels. We can also see new abnormal blood vessels grow within the eye, and it is this vasculopathy that we need to diagnose at its earliest stage when it is best treated. Our retina specialist will treat diabetic retinopathy with the diabetic laser, and in most cases, this can be treated successfully, saving your vision. While it is important that you do your very best to control your blood sugar, it's also even more important that you not be lulled into a false sense of security, because even with perfect control of your diabetes, even with perfect blood sugar control, it is still possible to have diabetic eye disease. In its earliest stages, diabetic retinopathy does not give you any symptoms of blurry vision. So there's really no way for you to tell whether you have diabetic retinopathy, even if your blood sugar is under perfect control. What most doctors recommend is, of course, good control of your diabetes, but also to visit your eye doctor at least once a year to be checked for diabetic eye disease.